Everybody, we are going to go ahead and get started. So my name is Morgan Harske. I am an agent manager with Security Health Plan. And today we are going to go over our individual and family plans from the health insurance marketplace. I just want to go through a few housekeeping items here. So everybody should have their cameras off, microphones on mute. That way we can keep everything running smoothly here. We will be sending out a link to the recording of the presentation in case you do miss anything or just would like to reference it again. If you have any questions as we are going along, I do have some help today in the chat, so feel free to pop any questions you have into the chat and we'll make sure we can get your questions answered here today. So starting with Security Health Plan and what we offer, who we serve, we have nearly 250,000 members, and we are the 6th largest HMO in Wisconsin. And our service area covers 33 Wisconsin counties for our individual and family plans. So we are in the top 10% of insurance plans for quality nationwide. And we offer an outstanding provider network through our Marshfield Clinic physicians. So we do have 4 plans available. So that's going to be the Enrich, Select, Simply One, and the Premier plans. As you can see on that map on the right side of the screen, those are the service areas for each plan, and we'll get into those a little bit more as we get into things here today. So with our individual and family plans, so the Affordable Care Act has expanded benefits. Those benefits that were expanded were things like no annual or lifetime dollar limits on coverage. So your healthcare coverage has gotten expanded. So your annual and lifetime dollar coverage limits were eliminated thanks to that Affordable Care Act, and the limits on how much you will pay for your medical out-of-pocket expenses were added. So in 2023, the most you'd pay is $9,100. That does not include your monthly premiums, and coverage is guaranteed for everyone. So you can't be denied due to health conditions or pre-existing limitations. And then insurance rates will be set by age, geography, family size, tobacco status, and the provider network. The Affordable Care Act did also apply, so there are essential benefits that must be provided in all of the plans, and we'll go through what those look like in a moment. So what is the marketplace? So you may have heard it called some other names, such as the health insurance marketplace, the federally facilitated exchange, or FFE, or the Affordable Care Act. So that might be some other names you may have heard. And so it's a online marketplace where you can shop for your health insurance and purchase that coverage for yourself and your family. And so the government actually is not a carrier at all. The federal government established the marketplace and the coverage and financing rules. So the health insurance coverage itself comes from independent health insurance carriers like Security Health Plan. And you do not have to enroll on the marketplace. So there are other ways to obtain that health coverage. But in order to take advantage of the cost savings, so there's some premium tax credits and subsidies you can get. So in order to take advantage of those, you do have to enroll on the marketplace. And there are, I'm sure many of you have seen with those plans, there are things called metal tiers. Those tiers are a way to segment various coverage categories. So for example, if you want less out-of-pocket expenses, then you would select coverage from a high metal tier like gold rather than silver. So looking at those metal tiers, so as you can see here, bronze is going to be for someone who doesn't utilize their plan very much. Maybe somebody who's healthy and mainly uses preventive care. On a bronze plan, you'll have a higher deductible and out-of-pocket cost. If you go up to silver, maybe you have a few more healthcare needs beyond just preventive care. Maybe you have some prescription drug costs. Those plans, the cost share and reduction plans, are available as well. Those are only available on the silver plans. And then for gold, those are usually people who are using their healthcare a lot more. If you have multiple health conditions, you need specialty care, maybe you're taking several prescription medications. So the gold plans have a lower deductible and lower out-of-pocket cost. Now on the right-hand side, you'll see the catastrophic plans. Those are only available to those under the age of 30. They cover regular preventive care, and they have the highest deductible and out-of-pocket cost. Below that is the high deductible health plans, or HDHP. Those are eligible for a health savings account, or HSA. These plans are with a high deductible, but then you can set up that health savings account where you can put money aside to use for your qualified medical expenses. So there is a set of providers that are going to be considered in the network for you. And so you must see a provider in that network to have your healthcare covered. All of our individual and family plans, both on and off the marketplace, are going to include Marshfield Clinic Health System, and that will feature access to 170 specialties, 11 hospitals, and that does include the region's only children's hospital, and more than 60 clinic locations. So looking at our plans a little more in depth here, so this is our select plan, and it includes the provider systems, of course, Marshfield Clinic Health System, as well as Essentia Health, Prevea Health, Hospital Sisters Health System, most of the Oakleaf clinics. But in order to find the most up-to-date and comprehensive list of in-network providers, I do invite you to check out our provider directory, which is available on our website. And then that select plan is available in the counties that are shaded on blue on the map to the right-hand side that you'll see on the slide there. Next is our Simply One plan. So this includes Marshfield Clinic Health System in its network, as well as several additional providers that's going to offer things like home infusion care, skilled nursing facilities, chiropractic care, mental health and autism clinics, home health services, and dialysis services as well. Again, the provider directory will give you the most up-to-date and comprehensive list, but that Simply One plan is available in the blue shaded counties on this map. Our Enrich plan includes Marshfield Clinic Health System within its network, as well as UW Health and Unity Point Health Meritor. Again, that provider directory will list the most up-to-date, and the Enrich plan is available in Dodge County only. And then is the Premier plan is our next plan. So that one is offered throughout an entire service area for our other three plans. Plus it is available in Adams, Juneau, and Shawano counties. That Premier plan has a provider network that includes 8,600 clinics, hospitals, and specialists. So that includes Marshfield Clinic Health System, Aspirus, Essentia Health, Hospital Sisters Health System, those hospitals in Wisconsin, the Mayo Clinic Health System, most of the Oakleaf Medical Network, Prevea Health in Wisconsin, St. Luke's Duluth, Theta Care, Unity Point Health Meritor, and UW Health. So the Premier plan has a much broader network, and again is available throughout all of our 33 counties that are covered throughout the state. So it does include the counties that the other three plans cover, as well as Adams, Juneau, and Shawano counties. And so for those essential benefits and preventive care benefits, so like I said, that Affordable Care Act does require the plans to all cover these type of things. So just to name a few that are on there, you know, your emergency services, hospitalization, some other services that are covered are, you know, immunizations, HIV screenings, a lot of those preventive screenings and tests that you need done, lab services, prescriptions. So a lot of those services that you'll see listed here on this slide, so those are going to be required to be covered underneath the plans for your essential and preventive services. And when you have a plan from Security, you actually get much more than just healthcare coverage. There are a lot of extra perks included on our plans. Some of those things are going to be like an over-the-counter credit. So every quarter, we're going to give you $30 to use towards purchasing select over-the-counter health and wellness products from our mail order catalog. They get shipped right to you, no cost for shipping. We also have a 24-hour nurse line that allows members to help themselves and their families to get the health information they need whenever they need it. That 24/7 nurse line, like I said, it's open 7 days a week. That does include holidays, so you can call anytime. You can use it as often as you'd like. There's no charge for that 24-hour nurse line. An extension of that, we also have Care My Way. So it's a telehealth service that's 100% covered. You can use that via phone or the mobile app. It's available in all 50 states, 24 hours a day, 7 days a week. So that's another way to get your care in a flexible option. We also have professional health coaches. They can help you with weight management, quitting nicotine, increasing physical activity, healthy eating, managing stress. So our health coaches can help you with a lot of things, keeping you healthy. We also encourage a preventive approach to healthcare. So that includes, your yearly physical exams. Preventive care can really help lower your risk for illness and disease and a lot of other health problems. And it can help improve your chance of living a longer and healthier life. So when you choose a plan with Security, you're getting coverage for all those important care screenings at 100%. So that's things like your annual wellness visit, colonoscopies. You do get 2 hemoglobins, those A1C blood tests covered 100% every year for those members that are diagnosed with diabetes. You also get the mammograms to screen for breast cancer covered at 100%. So we really want to make sure that we get you covered on those preventive things so that you can live that longer, healthier life. You also get Global Fit on your plan. So that gives you access to premier fitness, weight loss, and wellness brands at a discount. So you can take advantage of educational materials, resources, and tools that can help you engage and motivate you to become more active and adopt healthier behaviors. So that gives you that option to get into some wellness brands at a discount, and again, take advantage of those educational materials and resources so that you can keep living that healthy life. And at Security, we are neighbors helping neighbors. So we live and work in Wisconsin. So when you reach out to our customer service team, you're getting a real life person right here in Wisconsin. So we've also increased the avenues that you can reach us at. So not only can you call us and talk right to one of our agents over the phone, you can also log into your My Security Health Plan account and you can connect with us via live chat. If it's not something that's time sensitive, you can also send us a secure message from that My Security Health Plan account as well. So we've got world-class customer service. If you've ever had the pleasure of talking with our customer service team, they are phenomenal. Like I said, it's a live person right here in Wisconsin, and they are very good at what they do. And it is important to update your application on healthcare.gov. So if you don't, you risk missing out on those cost savings. So there is cost sharing reductions that reduce out-of-pocket expenses for the silver tier plans. So those out-of-pocket expenses are your expenses for medical care that are not reimbursed by the insurance. So those deductibles, co-insurance, or co-payments. That's what we're looking at there. So the advanced premium tax credit, or APTC, that's a tax credit you take in advance to lower your monthly premium. If you take more APTC than you qualify for, you'll have to pay back the excess when you file your federal tax return. If you take less than you qualify for, then you get the difference back in the form of a tax refund when you file that federal tax return. And with the changes of the American Rescue Plan Act signed by President Biden, the premium tax credit guidelines for all marketplace plans were adjusted. So what does that mean? So that means regardless of your income, you will not have to pay more than 8.5% of your household's annual income for the second lowest cost silver plan available in your county on the marketplace. Remember, to receive these extra cost savings, you must update your application on healthcare.gov. So how do you get coverage so you can take advantage of these increased subsidies? So if you're currently enrolled on a marketplace plan, all you have to do is go to healthcare.gov and update your application. If you are enrolled on a plan that's not on the marketplace or currently uninsured, you can go to www.securityhealth.org/IFP plans and enroll, or you can talk with a friendly, knowledgeable, and local Security Health Plan consumer sales associate. Their number is going to be 1-844-221-9345, Or you can visit one of our answer centers. Those are conveniently located right in our clinics, our Marshfield clinic locations, and you can meet face-to-face with the licensed sales representative. You can schedule an appointment to go there on our website. That would be www.securityhealth.org/answer centers. And the information needed when you apply for health insurance on the marketplace. So you'll need your social security number or document numbers for any legal immigrants who need coverage. You'll need your employer and income information for everyone in your family. So you'll need those pay stubs, W-2 forms, or wage and tax statements. And then information about any job-related health insurance that's available to your family and an email address. And so beginning November 1st, today, you will be able to compare plan options. You can calculate what tax credit you might qualify for and enroll in a plan at www.securityhealth.org/myplans. So the open enrollment period begins today, November 1st, and then goes until January 15th of 2023. If you are re-enrolling for 2023 and want to stay on the same plan, you will not have to make any changes during the open enrollment time period. Your enrollment and tax credit information will automatically be updated with no break in coverage. However, we do encourage you to update your applications on healthcare.gov just to ensure you are receiving the maximum amount of extra financial help available to you. So remember, for your coverage to be effective January 1st, 2023, you do need to enroll by December 15th, 2022. So I know you may be asking why that is. So if the open enrollment period goes until December, the open enrollment period goes through January 15th of 2023, but any enrollments between December 16th and January 15th, those will start on February 1st of 2023. So you do have until January 15th to make a plan change or enroll, but if you want the plan to begin on January 1st, you'll need to finalize your enrollment by December 15th. And again, to get started, you can give us a call at 1-855-862-6859. You can see details online at www.securityhealth.org/myplans, or you can email shp.ifp@securityhealth.org to request a quote. So now let's open it up to you folks. Let's see, what questions do you have?
Hi, thank you, Morgan. We do have some questions that came in through the chat. One of them is, what are my options if I snowbird out of the area, such as Florida, Arizona, or Texas?
Let me see here. Is you do want to stay within the network on our individual and family plans, but I can definitely look into that and see what options you have for snowboarding. And we will be providing a document with all the questions and answers that we have today, and that will be in your follow-up email as well. So let me check into what we can do for snowboards and how that plan would work best for you.
And then another.
So I did ask one of our experts at the Security Health Plan, and one response she had was Mayo Clinic in Florida and Arizona would be considered in network for individual and family plans that have Mayo Clinic in their provider network.
Perfect.
But I do think we should probably look a little bit further into that as well.
Right.
Thank you, Ashley. Another question, Morgan, was what kind of coverage do we have for out-of-country emergencies?
For out-of-country emergencies, I believe out-of-the-country emergencies are covered. Let me just pull up and double check that one. I just want to make sure. Yes, so you will be covered for urgent care and emergency care worldwide with our individual and family plans.
And we just got another question kind of along the same lines of what is covered when members travel for vacations out of state, such as a week on a cruise or a week on the coast. That would work the same way, correct?
Correct. Yep. So if it's a urgent care or emergency visit, that would be covered no matter where you are.
And then another good question was, are health coach and care management services $0? Is there any cost to the member for those services?
No, there's no cost for those health coach services. Those are included for you within your plan.
And Michelle just asked if there's a list available for labs that are covered.
Yes, our online provider directory, you can search for labs specifically to see which ones would be in the network for your plan.
And that's all I see. Does anyone else have any other questions?
Again, we will send out a link to the recording along with the questions and answers follow-up so that you get all the answers to the questions that we did have come in. But if you are thinking of anything, feel free to put that in the chat so we can make sure we get that answered for you today.
Sharon asked if we offer any plans outside of the marketplace.
I believe we do offer plans outside of the marketplace, but just remember that to get the cost savings, you do have to enroll on the marketplace.
Yeah, all of our plans that are available on the marketplace are also available off the marketplace directly from Security. All right. I don't see anything else. So thank you everyone for joining us today. And we will send out the recording and, like Morgan said, all of the question and answers to everyone that attended today, as well as everyone that was invited to the webinar to begin with. So if you know of anyone that missed it, we'll get that information to them as well.
Thank you for joining, everyone.
Yes, thank you. Have a great afternoon.